few patients. Here we go. Hello, everyone. It's Friday, September the 11th, a day that will live with all of us forever. And I'll get to that in just one second, but all of us surely know of the attack on America, the attack on our Twin Towers, the attack, in a field in Pennsylvania, and the attack on our Pentagon. So we all will remember that forever, and this date will go with us until we die. So let me tell you just this, that today in West Virginia now we're up to 263 deaths, 9 additional since Wednesday. The 255th death is an 80-year-old male from Kanawha County. The 256th death, a 90-year-old female from Kanawha County. The 257th death, an 88-year-old male from Kanawha County. The 258th death, an 86-year-old female from Logan County. The 259th death, a 90-year-old male from Kanawha County. The 260th death, a 93-year-old male from Raleigh County. The 261st death, a 77-year-old male from Putnam County. The 262nd death, a 59-year-old male from Fayette County. And the 263rd death, a 79-year-old male from Kanawha County. Now let's just step back and just think about it just one second. With the exception of one person that was 59 years old, a male from Fayette County, it surely seems like that many of these people are really depending on us, are they not? Whether you're 80, 90, 88, 86, 90, 93, are they not depending on us? And they are. And really and truly, I hate to say it, but we're all, as West Virginians, responsible to try to help them. I mean, these people, whether they be in nursing homes or they be at home, and they've lived an incredible life, and they've given so much wisdom and so much goodness throughout their lives to all of their families and to all of us. We ask you keep them in your thoughts and your prayers, but more than anything, I ask today for you to just step back and say, we're all letting one another to some degree down. Now, our numbers in West Virginia today are 1,157 new positives. Our positivity rate has dropped a little bit. It's down to 4.18, and that's surely better than 7. Our cumulative rate is still at 2.58. Our active cases are 2,849, and that's up about 50, 70 from on Wednesday. And this is the first day that the active cases, wait just one second. That's incorrect. It said this is the first day our active cases total have dropped since August 26th, and that's incorrect, I think. Our recovered cases are 9,062. Our hospitalizations are the same as Wednesday at 147. We have 2 new counties that have now gone orange, and we have 10 counties in the orange and 1 county in the red. And our RT value is at 1.46. I think that's the highest it's ever been. And we still continue to have a reproduction number rate, an effective reproduction number rate, meaning that we are right now, for every person that is positive, we are infecting 1.5 times that number of people, as long as they're out in the public and they're infecting those people. So, the rate basically being the highest in the country is surely alarming. And there's many other things from the standpoint of counties passing on into the orange and counties remaining in the orange. So, what do we do? And I want to read this to you just one second. We talk so often, to everybody, and I solicit views from each and everybody. But the bottom line of this thing is it's the whole essence of what we have to do as West Virginians is stay together. There's no question that all of us are in this together. Are we not? Of course we are. All West Virginians are in this bucket together. So we've got to continue to work together. We've got to continue to try to protect the health and the safety of all West Virginians. Am I not right? Absolutely, I'm right. We have got to protect the health of all West Virginians. Now, the West Virginia citizens are no doubt the number one priority that I have. Now, in order to be able to take care and to help us, we have got to really know that without any doubt, we have got to step it up. This is going the wrong way. We have got to step up all of our concerns. To just tell it like it is, we've got to get afraid again. We have gotten complacent, and really and truly, we just know that this thing, we hear the numbers are getting worse and getting worse, but just tell the truth. Too many of us believe, oh yeah, but our national numbers look good and everything's going to be okay, so I can go do anything and everything I want to do. And the numbers keep getting worse, and the people keep dying. And all of a sudden it's going to come home, and it's going to come home to each and every one of us if we don't watch out. It'll come home to some families tomorrow. Those families got a name. They're somebody. They're West Virginians. So all of us have got to take responsibility. You got to take the responsibility for yourself. This person said, it's high time that we all take some responsibility to know and look out for one another even more than we already are. We got to continue to follow the guidelines. It's as simple as that. And we got to all do what we have done the very, very best. We've got to pull the rope together as West Virginians. And I am not just preaching to the choir. I am absolutely pleading with you to take my words and take my words very seriously and try with all in you to pick it up a level, to absolutely become more concerned. I hate to make you afraid, but to become one notch more concerned and one notch more afraid. Now, as far as our counties that are going orange, or our counties that are in the orange, it is just flat, in my opinion, not safe, with our numbers trending the way we are, to continue to go to school if you go orange. Now, we set out in the beginning and said, if you're yellow or green and you move into the orange, we cannot play competitive sports. We can continue to practice, but we should not. If you're in the green or the yellow, we cannot play competitive sports. We'll continue to practice and we'll continue to go to school. I don't think we can do that right now. And so really and truly, effective now, if you go orange, especially with these numbers the way they are, we're not going to go to school. Now that's all there is to it. If you go in the orange, we can't go to school. And if you're in the orange, you continue in the orange, we can't go to school. That's all there is to it. It's just as simple as this. We're putting our kids in danger, and we're putting our teachers and our service personnel in unnecessary danger because these numbers are everywhere. They're going all over our state. Now, we have got to just buckle up and know that's how it's going to be. Now, there's lots and lots of additional information that everybody's working on. Everybody's working on, travel ball teams. Everybody's working on, should we allow that, not allow that? Everybody's working on, should we move more aggressively in the counties that are red or orange from the standpoint of should we move more aggressively towards shutting down restaurants or shutting down bars or whatever it may be? Do you realize we're dealing with life and death here? And we have got to do everything in our power as far as wearing our mask. If we just wear our mask, we'll shut this thing down. If we just use good judgment, we'll shut it down. Do you think does anybody in their right mind think that I don't want our kids in school? That's crazy. Does anybody think I want to go back and start shutting stuff down like, our businesses, our hair salons, or our restaurants? There's no way. I don't want any part of that, because it's going to hurt us and hurt us in lots of ways. Now, with that all being said, we don't have to do that yet. But we got to wear a mask, and we got to absolutely know that we can't possibly go to school in an Orange County, put our teachers, exposed and everything else. We can't do that now. And I'm just not going to have that. That's all there is to it, is because I, in my heart, believe that it's unsafe, and I don't want that. I don't want to be sitting here with 10 children in a hospital or a situation that we just saw on Fox News or CNN where 3 teachers across this country now have died, and I don't want to get in that situation. And so with all that being said, that's what we're going to do in regard to the counties. You've got to really pay close attention, to where you are, when your color coding comes out tomorrow evening. We're going to, the other thing I'm telling you that we're going to do, everybody's going to continue to work through the night tonight and all through the weekend and everything. And we're going to come back to you with additional guidelines and on both sides of the fence. Everybody's got to know that in this kind of situation, what do? You continue to tweak and tweak and tweak until you make this thing work for everybody. Now, we're looking at it from a sports aspect. We're looking at it primarily from a school and a scholastic, aspect. That's the first and foremost. School is the first and foremost. We're looking at it as an economic aspect as to what to do there. But absolutely, we're looking at it from a travel standpoint. We're looking at it from, like I've said before, our businesses and our communities and everything. But we have got to turn the tide because now is our time. Right now is our time. Now is the quiet time before the storm. We can already see the roughness in the storm. And we already see it and we already know it. The other thing is just this, is we need to test more and more and more and more. You see, it could very well be in some ways not testing enough is driving our numbers up. It doesn't drive your numbers down by not testing. The more that we test, the better off we'll be from the standpoint of being able to drive our numbers down. Not only will it give us a whole lot more information, but it will drive our numbers down. If we don't test, then the very, very, very few people that are the sickest, and when we test those, it drives our numbers straight through the roof. So, now, let me move on. Today, like I said, is 9/11. A day that'll live with us forever and ever and ever. Now, it's hard to believe 19 years have passed, and it seems like it was just yesterday. I was actually driving down Interstate 64, not far from Lewisburg, when the call came to me. Unbelievable, just totally unbelievable. You know, there was 2 people from West Virginia there that lost their lives. And I think it's Mary Lou Haig and Paul Ambrose. Paul Ambrose's family was with me earlier today, you know, when we had another cadet class graduating from from our state police academy. And we surely tried to honor their son Paul and them, and Mary Lou as well. And so, you know, it is a day that we will carry with us forever. But I have to just say just this. We lost slightly on that day, slightly less than 3,000 people. Today in the United States of America, in our country, we are approaching losing 200,000 people in this pandemic. Now, we all know the seriousness that we took with 9/11, and we should have, and we should carry that with us forever. But this pandemic is absolutely multiple times that. And we have got in West Virginia to really buckle down right now. Today also is going to become Heroes Day, actually tomorrow. And we did this last year, but I am issuing a proclamation declaring tomorrow, September 12th, as Heroes Day in West Virginia. And if you just think about the bravery and the sacrifice of first responders, firefighters, law enforcement officers, emergency medical services workers, the 9/11 telecommunicationists, or communicationers, all those people. In West Virginia, these people are some of the most courageous and dedicated first responders that there could possibly be. So we're dedicating tomorrow to that day, Heroes Day in West Virginia. Now, if I could just jump on to just this, and that is, there's in regard to our PPE that is going out to our schools and everything, that at my direction, the National Guard has put kits together for every school nurse in all public schools across this state. Each kit consists of N95 mask, gloves, and a gown. And each nurse will have multiple kits, and the Guard will deliver today to each of the county school superintendents. I will also make sure that every nurse continuously has the PPEs. Now, there's more and more and more PPE on the way, and it's coming, and absolutely you can rest assured that we will cover every PPE request from every nurse or from every school or from every superintendent in our state. All the public schools in West Virginia have received 318,000 total cloth masks, and they were delivered to each county school superintendent in June in preparation for the school year. 27 higher education institutions have received 100,000 cloth masks. All 55 counties received a total of 753,000 cloth masks. The distribution was based off the percentage of population. The total cloth masks delivered by the Guard out of our stockpile is 1,171,300 cloth masks have been delivered. Now, in addition to that, we have in our stockpile 2 million additional masks. We are absolutely ready and we're moving forward, but we can do so much more, West Virginia, if we'll just all get in this together. And I know you have been, but we got to have you even more. Scott Adkins is with us on Workforce today. If you have any questions about anything there, you know, our ABC officers at my directions, the West Virginia Criminal Investigation Division under the Department of Homeland Security is loaning the West Virginia Alcohol Beverage Control Administration additional personnel that will be trained as enforcement officers. This will ensure the ABC has more manpower to enforce alcohol laws and to make sure that the safety protocols are being followed and that we're kept safe as we can possibly be. Yesterday, the FEMA administrator, Pete Gaynor, came to West Virginia. We were able to talk and everything and thank him for his assistance, and he pledged to us that he would continue to try to help West Virginia in every way possible. As of today, there are 39 outbreaks in our long-term care facilities. There's 7 new outbreaks since Wednesday. We have 5 active outbreaks in our churches. That's up from 4 counties. I'm sorry, that is in 4 counties. That's in Mingo, which is a new one, Kanawha, Wayne, and Wyoming County. Again, I keep going back over and over and over and to tell you many, many, many times, that at our churches, that is an area where we've got to really be careful and really watch. Stay a pew apart, absolutely wear your mask, social distance, wash your hands, take care of the elderly. Please, if you could just skip a few times at church and get your services online or whatever it may be, absolutely, I think you should really take that to heart and think really hard about doing that. Our corrections update at Mount Olive, we're down to 25 active cases. There's no active cases at any regional jails or juvenile centers. We have a total of 25 active cases among our corrections staff. From a standpoint of our public higher education institutions, at our public higher education institutions, 140 students have been tested positive and 7 staff. This includes 4-year colleges and community colleges and was reported to my office by HPC. Okay, or HEPC, I'm sorry. The small business grant program now, we've gotten 3,600 applications. We've gotten out a little over $14 million that's been awarded. We're running out of time. September 30th is the cutoff for this, so you gotta apply pretty quickly if we want to get this out to you. Our grants to our cities and our counties still going really great. We've gotten out just under $107 million now. 191 cities and counties have applied, and I continue to urge you to continue to apply. We'll continue to send the money out. Our free testing. Today we're in Cabell, Mercer, Putnam, Raleigh, and Wayne counties. Okay. Now listen to me. Please, come back to me, Jordan. Just listen to me and listen to me really closely. We're in Cabell. And Cabell County they're doing pretty decent right now, but they were really close to slipping in the orange. Mercer, Putnam, Raleigh, and Wayne counties. And all of y'all know those counties are either in the orange or close. Now, free testing. Do you realize the more we test, the more the numbers will go down? Now, we're not just going to go out and test so we can get our numbers down. That's ridiculous. But the more we test, the more we learn. The more we're able to help you in every way. Let me give you a perfect example. Let's just say that we tested and we found 1 band member. We found 1 football player. We found 1 person that's going to working at a deep mine. What could we do we could save so many people from being infected, and the net of the whole thing is your numbers will go down. The more we test right now, especially younger people, flood us with young people tests. The reason I say that is because, and you'll hear from Dr. Marsh in a little while, we're having a rash of people from 10 to 29 that are testing positive. We got to know that. So please take advantage of this free testing. This weekend we'll be in Wayne and Mon counties. Next week we'll be in Calhoun, Boone, Doddridge, Nicholas, Harrison, and Kanawha counties. Please take advantage of this free testing. You know, it'll help us in all kinds of ways. Now, about the only thing I can smile a whole bunch about today is just this: is, you know, West Virginians, you've just done fabulous on this census stuff, and you're at 98.1% counted. You know, it's amazing. It is truly amazing, and that's really good. It'll pay great benefits for us in the future. Thank you so much, and run across the finish line. Keep trying to help here and everything, and again, you've done great work in regard to that. You know, I guess from the standpoint of school outbreaks, and you know what that means. That could mean, a staff member or somebody like that's tested positive. But today we have in Brooke County, we still have the two in Brooke County. We've got Brooke County Primary North and Brooke County Intermediate North, and we in Lincoln County we have Duval. In Lincoln County and in Wyoming County we got the technical center there. In Mingo County we've got Mingo Central High School. In Kanawha County we have 7 schools, and of course they're not open because they're in the orange, and as is Mingo County at Mingo Central, and we're continuing just to do the contact tracing and all the work that our health officials and everywhere are doing. So last thing I would tell you is just this, is on the chart, if you'll look, you know, the only one really that is the most important today is the middle one. If you'll look, you know, how we jumped up there in the daily positivity rate, but we did drop down significantly from 7.56% down to 4.1, I think 8, or maybe 4.16, and that's surely the direction we want it to go. You know, again, just so everybody will be absolutely certain to what I'm saying, is if you are a county, even if you've been in yellow or you've been in green and you go to orange, we don't go back to school. We just do not go back to school until you get out of the orange. If you're already in the orange, you don't go to school. You know, from the standpoint of any aspect whatsoever today, it's just basically not safe, in my opinion, for you to do that. And so, you know, we have had all kinds of interaction with Superintendent Birch and Dr. Marsh and all the team. Everybody's been weighing in every direction, and we'll be issuing additional details later today in regard to this and everything. But in addition to that, I want to tell you from the standpoint of fairness and from the standpoint of it being a fluid situation and how we should, how we should tweak and do things like that from the smaller counties and even the bigger counties, in the effort of trying with all in us to be safe beyond belief and get our kids back in school and do all the things, and knowing how impactful that this is for as far as you don't have daycare, you do have daycare, all those issues from the economic standpoint, you got to be able to go to work, all the different things that this is causing us, we're working on it. Through the weekend, you may very well see additional tweaks to what we're trying to do, and we're just trying with all in us to make it better and make it work better for everybody. From the standpoint of sports, scholastic, economics, every aspect of it. But the number one thing the number one thing is we got to be safe. We got to protect all of us as best we possibly can. And so please, please take heed to what I'm saying. That's all I got. Thank you.
All right, thank you, Governor. First today, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard continues to support a number of testing operations, continue to support the rollout of mobile broadband to support our children as they learn in this unique environment, continue to work a significant number of disinfection missions, and as the governor pointed out, have distributed an unbelievable amount of PPE for a variety of individuals across this state. I'd like to take the last part of my time just to talk about and reflect on September the 11th and the meaning. Not only were there a couple thousand innocent civilians who lost their lives and whose families are still to this day impacted by it, but I ask us to remember the first responders who knowingly went into harm's way, knowing that they may not make it home at the end of the day to their families, but they did it because making a sacrifice for others was the right thing to do. I ask us to remember the thousands upon thousands of military men and women since September the 11th, 2001, who fought on the front lines across the globe to address the threats of terrorism. I think it's important that we remember in West Virginia that one of the first special operations units in Afghanistan to go after the perpetrators of the events of 9/11 was a West Virginia National Guard Special Forces company. And since that time, thousands of men and women have gone into harm's way, knowing that they may not go home to their families, but it was the right thing to do to sacrifice for others and for the greater good. So at this time, I ask us, in honor and recognition of all those folks, as West Virginians, to step up and sacrifice and make the right decisions and do the right things on behalf of the sacrifices of all those others, and to protect our fellow citizens so that we can bend this curve back again and get West Virginia back on the right track. Thank you.
All right, thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. This is a somber day for many reasons. Certainly, as the governor and Major General Hoyer articulated, today is 9/11. It is a day of tremendous suffering and sacrifice and service, and a point in time, a date and time that's really changed us in many fundamental ways. I think the governor did a really good job articulating the challenge that is in front of all of us. And I am oftentimes spending my time citing numbers, but the governor pointed out that we, for the fifth day in a row, I believe, have the worst reproductive score in the country, meaning that COVID is spreading in West Virginia faster than it is anywhere else in the country. We are losing more people. The first 100 deaths took 110 days in West Virginia. The second 100 deaths took 41 days in West Virginia. And we are at a pace to get to the 300th death much faster. The Washington site that does the projection numbers says that at the rate we're going, we're going to have 1,600 deaths by the end of the year. And that is not something that we should not be aware of. And I think that when you are dealing with very unique events, like we are today, like we are with this pandemic, that is also very likely to indelibly change us in the future in many ways, that there's no playbook, there's no pre-existing approach. But the thing that I believe is the most important right now, and I actually feel the governor has done an amazing job with it, and I'm trying to be apolitical here, but is you have to choose your principles. You have to choose your polar star, your true north, and you have to follow it, because there's so many different ways that you could go right now. Certainly, we know that people are tired of trying to exercise their power over this virus, even though we still have it, to wear our mask and stay physically distanced and to stay separate physically, but still connect emotionally and virtually is the way that we reduce the virus spread. But people are tired. And we look at the economics and we look at the fact that many people want to be back in school and want to be back in sports and want to be back to the normal life that we all enjoy and enjoyed before COVID-19 and will enjoy after COVID-19. But right now is a special time of service requirement. And that requirement is really on all of us if we prioritize, as the governor said, to make our polar star protecting each other, loving each other, caring for each other, supporting each West Virginia citizen. And you do that by protecting yourself, by committing to a higher set of guidances. And we understand that some people think that if you don't get tested, well, the number of tests won't show up as positive, and therefore the rates will go down, and therefore your counties will turn a better color, a yellow or a green. But in fact, as we look at all these numbers, we also know how many people are getting tested and what is the percent of tests that are positive. So we look at all these things as we render those decisions and recommendations to the governor related to, where we believe the map should be. And even without that, it's really about reaching a higher cause, reaching a higher level of service to each other. Because we know that people who spread this virus spread it before they know they have it or before they get symptoms. So we all could be housing the virus. And if we care about each other and the people that we love and the vulnerable and the people that are working as essential workers, first responders, hospital people, people that are out in the stores and et cetera, then we should protect ourselves because we protect them. And as we make it through together, and staying together is the key, then we will be in the position where everybody will want to be with us because of how we reacted during this crisis situation. So I, like the governor, am really imploring and begging and asking you, West Virginia residents, citizens, businesses, entities, to come together and show the spirit, show the power, demonstrate the power that we have against the virus, and do the right thing. Hang in there, stay focused, and don't get tired and don't get complacent, because really our future is depending on your good action right now. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Scott Adkins, the Acting Director of Workforce, West Virginia.
Good afternoon. I want to talk about the LWA, or Lost Wages Assistance Program. FEMA notified West Virginia that funding for LWA is exhausted and concluded with the week ending September 5th. LWA payments in West Virginia will cover the weeks ending August the 1st through August the 29th and the 6th week of September the 5th. West Virginia has been approved to disperse just over $116 million for 6 weeks from August the 1st through the week ending September 5th. We've talked about this a little bit before, but we're still getting lots of questions about eligibility. To qualify for the full weekly LWA payment of $400, you must be eligible for at least $100 in weekly benefits, and you have to self-attest that your unemployment or partial unemployment is due to the disruptions caused by COVID-19. And we're currently doing that with the recertification that folks who are on unemployment have to do every Sunday. Individuals who do not meet the FEMA requirement of the $100 in weekly benefits at Governor Justice's direction will receive a $100 payment from West Virginia. So if your weekly benefit amount is less than $100 that you're eligible for, you're going to receive your weekly benefit amount plus $100. PUA individuals will be paid in the same manner as they currently receive their unemployment benefits. So if you're an independent contractor, you're self-employed, your LWA payments will be dispersed either by debit card, the KeyBank debit card that you currently use, or by direct deposit. If you're on regular unemployment or some of the CARES Act programs like PEUC or extended benefits, you'll receive your LWA payment via paper check. Lots of folks have asked, why do we issue that with a paper check? We're actually using a system that Workforce already had in place so that we could expedite those payments. If we were to pay folks in regular UI, PEUC, or EB, we would still be about 3 or 4 weeks away before we could make that payment. And so in the best interest of getting those funds out to struggling families, we decided to issue those checks via a paper check drawn on account with BB&T. LWA payments are scheduled to start to go out next week. So the plan is that you'll receive one check, one debit, either on the, or one credit on your debit card or into your direct deposit amount. If you meet the FEMA eligibility requirements, you should receive a credit for $2,400 less any taxes. If you don't meet the FEMA eligibility requirement for the $100 weekly benefit amount, then you will receive a $600 check less taxes that you chose to withhold. So I hope this clears up some of the confusion. If you still have questions about LWA, feel free to go to our website or to call 1-800-252-JOBS. Thank you.
All right, thank you, Scott. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have so many questions, but I only get one. So I'll ask two and try to slide an extra one in. Governor, you mentioned out-of-state travel ball, and you're working on it. We've been told that there are more tournaments scheduled for this weekend, including one in St. Albans. Your thoughts about that type of activity taking place in a county which is coded and does not allow high school and middle school sports to take place? That's just kind of a quick question. The bigger question I have is there looks like at least the beginnings of some sort of educational insurrection, for lack of a better word, starting in Putnam County with a board member making public his beliefs that the county should be leading the way and handling the COVID-19 pandemic and whether schools are open or not. That board member has sent you a letter and made it public and has stated that county board members who were elected by the citizens of Putnam County should have more leeway and more direction in making the decisions about whether students are in class. Your thoughts about the travel ball and your thoughts about the efforts in Putnam County and that letter, and if you have any comments about what the board member had to say. Thank you.
Well, Kenny, let me address the second question first, and just let you know that my staff has been in contact with the board member. I haven't been briefed by, from my staff, as of yet and everything. But I can tell you, Kenny, we're going to continue to solicit, and we welcome information from anybody and everybody. Just to tell it like it is, everybody's got an opinion about what ought to be done. I think that I've surrounded myself with a group of people that are extremely knowledgeable, extremely compassionate, and absolutely, knowledgeable in the medical field, the education field, just knowledgeable in every aspect of what we're trying to do. Now, with all that being said, decisions are being made with a collection of all kinds of medical information, all kinds of information from the county superintendents to the local control plans from the standpoint of the local health officials. Everybody is weighing in on this, not just a county Board of Education member, which is a really important position within a county, but everybody's weighing in on it. And so I have not been briefed, but I can tell you just this, that there's so many people that are absolutely on top of their game in every way, that are trying to do the very best we possibly can to keep the citizens of Putnam County, as well as the citizens throughout all of our counties, safe, and absolutely still be able to do all the privileges that are out there in so many different ways. So, now, as far as the next question you asked in regard to the travel ball, Kenny, just to tell it like just straight up of the way I see the whole thing is I would say we don't need to be doing that. That's all there is to it. We have looked into it. You know, the first thing, we went to the county, and the county said, well, we can't really do anything about it because it's on the Board of Education property. And so, well, we can't really do anything about that. Well, in my opinion, we best better be trying to do any and everything about that from the standpoint of the board, the county, anybody, any and every one of us, because this is the very stuff that if it's done and it's done in the wrong way, this is the very thing that will lead to compound more problems. You got Kanawha County that's in the orange. You can't play ball. You know, from the standpoint of the schools, it doesn't make much sense to me to be having travel ball, you know, in the county, especially, you know, like Kanawha County with the orange that we have right now.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. A question about mask wearing and the RT spread value. I think early on, Dr. Marsh said that if we got to 60%, that would be good. If we got to 80%, that would be outstanding. Are you monitoring via some source how many people are wearing masks, how many people are complying, and if that may be the reason for the spread that some people aren't wearing it as much as we would like?
Paul, let me say this, and this was somebody else's poll, and I don't recall who's, you know, whether it was the, you know, CDC's. I don't know if it was the I don't know whose poll it was. It said in the state of West Virginia that 92% of the people thought we absolutely ought to make it as stringent as we can possibly make it. 92% of the people said to absolutely do anything and everything we can to make our mask wearing mandatory and to enforce exactly that. And Paul, I've tried. I've really tried. And I have tried every way that I know and everything. Now, you know, we can't go down the streets and haul people off to jail. But Paul, you and I know just as well as I'm sitting here that somebody that just stands up and says, well, there isn't anything to this. This is nothing but the flu, or that's my right. I don't have to wear a mask because that's my right. You know, Paul, to me, whether it's your right or whether you really believe that this is not true, what's going on and everything, in both instances, in my opinion, that's wrong. But for just the betterment of all of us, because just doing it will absolutely help all of us to be 1 ounce safer. Why in the world don't we do that? Why do we have to be so stubborn and know these numbers are getting worse and kids aren't able to go to school and all everything about this? And we know if we would just wear our mask all the time, you know, when we're outside, you know, and we're going in public buildings and whatever, or not public buildings, but we're going in buildings, you know, or we're in any kind of setting that would be where people would be in close proximity to you. Why in the world can't we wear a mask? I mean, for crying out loud, it is absolutely so simple. But, and I think we're doing pretty good, but we got to do a lot better.
All right, thank you, Paul. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. I'm a little confused as to switching to orange. Obviously, kids are in school today, so I'm assuming that starting Saturday night is when counties that go into the orange are going to have to go not have in-person school, go to distance learning. And also, obviously, according to the metrics, when a county goes orange currently, they have to cease, you know, extracurricular activities in sports, but they can do controlled practices. So if under this new guidance, if a county goes orange, then does that mean that they also have to cancel their extracurricular practices and fall sports practices? And doesn't that basically just do away with orange altogether? Doesn't that mean we have a green, yellow, and red system? Thank you.
No, Stephen, and I appreciate your questions from the standpoint of being able to be more clear in what I'm trying to say. But if from the standpoint of we've got to have a cutoff period. From the standpoint of orange, it doesn't just put us on high alert like red would. We don't shut it down that day, but we use the same guideline on Saturday night for the following week. So if we're orange on Saturday night, we're out of school for the next week. That's all there is to that. From the standpoint of sports, and all these guidelines will be coming out here later on. From the standpoint of sports, where we were allowing practice to continue on and everything, and face to face, I really believe now that we've got to tweak that just a little bit and say just this: we will allow conditioning to continue, but we have to some way back away from face-to-face contact. So we're going to modify that as well to allow our athletes to continue to condition. But as far as face-to-face stuff, we're going to have to back in contact. We're going to have to back away from that. And the reason for that is just real simple. If you're a football player, soccer player, whomever, cross country, whatever it may be, we sure don't want to get in a situation where we just stone stop everything and we have our athletes decondition and then all of a sudden go back and try to play with one day's, practice or whatever, and then end up in a situation where we've got a kid real sick or something like that would happen. That's not any good. So we continue to condition, but we're going to have to back away from the, contact stuff.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. I don't mean to plow over old ground today, but I'm getting more questions. And again, this, like Kenny Bass, touches from Putnam County. A number of healthcare professionals in Putnam County have reached out to me. They are not only healthcare professionals, but parents, and they're concerned about the continuing discrepancy in the numbers. For example, on Wednesday, the Putnam County Health Department online was posting that it had 16 new cases, but the state numbers showed only 7 new cases. And their point here being about the discrepancy is this could make the difference between Putnam County being orange or being yellow, and they're concerned about the discrepancy of the numbers, if you could address.
Well, Mark, I would just say this, that before these numbers come out on Saturday, as they came out last Saturday, those numbers were perused and checked and checked and checked by a panel. There was a lot of discussion. They were checked and checked and checked. I would be enormously, enormously disappointed if now I found out that there was an error. But I think Dr. Amjad or Secretary Crouch maybe needs to comment on your concern and the concern of the people in Putnam County.
Mark, I've gotten some of those questions myself. They've been pushed to me. I've responded to several inquiries regarding those calculations. As I talked, I think it was last week, it might have been the week before at this point, but there is a delay in terms of trying to or attempting to reconcile those numbers and actually making sure that the data is accurate. The surveillance system that we used is tied into local health departments. They enter that data. Lab results, as I've said before, come in to the county and to the state, but those numbers at the cutoff of midnight may not be completely accurate with regard to location in terms of residence where individuals live. We find many times we've had several nursing home outbreaks where the individuals actually live in a county across the county line, but work in a different county. So the investigation that's done by the local health departments makes sure that we have the county of residence in there for the patient. We have duplications occasionally because, again, we still have a few labs out there who've been
contracted with, not by the state, but with local providers who have not gotten tied in electronically as quickly as possible. So as new labs come on, we have to find out who those are, and we have to get those labs hooked in electronically so that information is received quickly. And then we also have the issue, as I've talked about before, of the prisons where we have inmates who are not included in the calculation because they do not contribute to community spread. And we have nursing home patients who do not contribute to nursing spread, so to community spread. So when we get that information in from the labs, we only get a name. So we're close to, we think, having a way to automate that, but right now that's done manually. So the information that comes in at midnight is used to update the website and the dashboard at 10 a.m. Monday morning. We then wait on the local health departments to investigate and provide accurate information to adjust that the following day. Now, what the governor mentioned with regard to the county maps, the school maps, and what we're looking at for the metrics for education, the cutoff for that is midnight on Thursday. So we spend Friday, and that's what our folks are doing today, verifying that information, making sure that we've pulled out all of those, excluded all of those cases that need to be excluded from the calculation, and that the duplicates are out of there, and that we have the appropriate county of residence, because that's an important map looking forward in terms of school and trying to get our children back to school safe. So that's the only date where we have a cutoff that's different from the dashboard. I hope that helps. There is a lag with regard to verification of the information through the investigation that's done by the local health departments, but we're working very well with those folks, and we appreciate them speeding that up and doing a good job trying to get that to us quickly.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia. Oh, hold on just a second.
Mark, I love your question. I love the concern of our people. I don't want to leave any stone unturned. Absolutely, without any doubt, as far as the color coding that will come out on Saturday, we absolutely will double check every single source to make sure that it is absolutely 100% right. And Secretary Crouch and Dr. Amjad, everybody needs to hear me loud and clear. I've said this 40,000 times. I don't care about, well, this could be this or this could be that and everything else. I don't care about that. I want it to be 1,000% ironclad right, and the people of Putnam County deserve that, as well as all of our counties, and there is no excuse if numbers are coming out on Thursday night, midnight, and we review those numbers all day on Friday, and then we review them on Saturday morning, and then a panel goes over them again, and we're in constant contact with people on the phone on Friday in the local health areas and everything, and all we're really concerned with is the counties that have turned orange, because the counties that turn red really and truly are orange beyond belief or red, and the counties that are yellow and green, they're good to go. So all we're really dialed into is the counties that are turning orange or are orange, and we're reviewing all that information today, and we're going to review it tomorrow, and then we're going to go over with the panel, and we better get it dead on the money right. And the people of Putnam County don't need to have doubt. Doubt is the worst thing in the world. When people see numbers and they jump all around and everything, and they're not consistent, then that not only makes us look bad, it absolutely reflects bad on so many different people, and it hurts somebody, whether it be our kids, our parents, the daycare, whatever it may be. Now, absolutely, without any question, in my opinion, there is no excuse. There is no excuse for us not knowing exactly when we tell a county they're in the orange, they better be in the orange. Now, that's just all there is to it, in my opinion.
All right, thank you, Governor. Now we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. We talked earlier about travel ball, but I think West Virginians could stand to hear more discussion of the philosophy on where the line is between an extracurricular activity for a school, for example, and other activities in the community. Many West Virginia students are missing out on classroom instruction right now and extracurricular activities, of course. That's where I'm coming from. But there's a motocross event this weekend in Fayette County, which is orange. Last weekend, there was an antique car show at the Greenbrier. Where is the line on what activities should go on and which shouldn't? Thank you.
Well, Brad, I can speak for this, and I mean, surely I didn't go to the antique car show at the Greenbrier, but I know that we've always got to put in a little dagger back towards the governor because he owns the Greenbrier and all that bit. But I can tell you this, that the Greenbrier, though, is checking people like you can't imagine. I mean, really and truly, because the Greenbrier's visited from a lot of different areas all over the globe, and those people are checked and double, triple checked and everything. They just had that World Team Tennis event there. Not one person, positive and everything. And I'm not sitting back and saying, that we're bragging on the Greenbrier. I'm not doing that. I'm just telling you that they check and check and check. Now, from the standpoint of the motocross or whatever it is that's going on in Fayette County, the CDC and the local people have assured us in every way. They're doing all the testing. They're doing all the distancing. They're doing all the protocol to follow the guidelines, and they're doing that. Now, I don't know any more about that event than just that. I can tell you this, though, Brad, and here's the straight stuff, is as we approach counties that are green or yellow, we should approach them differently to some degree than we do a county that is, orange or red, from a standpoint of whether we should be having travel ball or whatever, the situation in those counties and everything. So that's my feelings. My feelings are point blank in that we as a county in Kanawha County, from the standpoint of the county commission, the board of education, the health community, our office, and everything else, we should be very, very concerned. We should vet these events very, very carefully to where we absolutely are sure that we can either have it and have it safely, or we shouldn't be having it at all.
All right, thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. My question goes back to the orange color coding. Was there one specific thing, Governor, that prompted the change as far as those students and staff being in school? And also, other than the conditioning, it seems like there's not much of a difference between the red and the orange. So just, I guess if you can expand on that a little bit more.
Well, Amanda, there's a lot of difference between the yellow and the orange. And the orange, and if I could have had my way completely about it. Now, the Harvard scale dictated in a lot of ways what we're doing here, but the orange range goes from 10 to 25. From the range on the yellow, it goes from 3 to 10. So it goes 7 ticks, and the orange range is really 15. More than twice of that of the yellow. And the green, you go from 0 up to just 3. And so Amanda, but getting back to more about your question is just this, is well, hold it. I've lost your question. Come back and tell me your question one more time.
Okay, just I guess expanding on the differences between red and orange, beyond conditioning for athletes, but then also, was there one specific thing that prompted you to make this change?
Okay, the one specific thing is just this, Amanda. Every day, all through the night, all day, I'm looking at these numbers. And if you look at the daily positive and you look at the 7-day positivity, average, and you look at how close we're bouncing to that 5% level, if you look at just what is going on within these counties, and we're growing more and more and more orange counties now, the real truth is we have got to do something now. If we don't do it now, this is pay me now or pay me later. We're going to end up with 30 counties in the orange, and then attacking this problem is going to be really, really, really hard. So we got to do something, and we got to do something right now. And the numbers are driving us without any question, saying, do something. You have got to do more. I mean, we don't like it, but you got to do more. And the more is just real simple, is we don't have any business compounding the potential of an already bad situation with being in school with our kids and with our teachers. And absolutely, we do not want to awaken service personnel, whatever. We do not want to awaken to the situation that's happened to 3 teachers across this country right now, or 3 grandmas, or whatever it may be. Now, Dr. Marsh, was with us. He could have helped, some more on this question. He's dropped off the call now. But from the standpoint of, and Amanda, I don't want to go back, but from the standpoint of the bracket between and the orange level, the bracket is big and everything, but yet, as it approaches the red, there's a dire need then to shut everything down. And I hope I've answered that. I've answered as best I could.
All right, thank you, Amanda. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I know our color-coded map also applies to our nursing homes. So does this most recent tweak have any impact on the nursing home system? Thank you.
I don't think so, but maybe Secretary Crouch, or Dr. Amjad, does it have any change? I don't think it does. I think they're completely separate rules. But
Governor, this is Bill. The nursing homes do make some adjustments with regard to visitation and communal dining and some of the issues related to having individuals together more than they would if they were yellow or green. So I'm sure they will follow that. They have flexibility in doing that, but so it may make them a little more cautious with regard to those yellow counties, but it really doesn't impact what their priorities are in terms of visitation.
But Bill, I don't think that has anything whatsoever to do with whether or not they go back to school or don't go back to school. I don't think anything changes when you go to when the rules that were already there. When we went to orange, the rules were already in place as to what they were going to do versus going to yellow. That's not the question, I don't think. The question was the tweak that we decided not to go back to school. The tweak in orange versus go to school, I don't think that had anything to do with the rules with the nursing homes.
You're right, Governor. That has no effect. They have rules for orange and rules for red, so it does not change. The fact that you made that decision does not change that. You're correct.
All right, thank you, Charles. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, Governor. Hi, everyone. This is Taylor. The families found out recently that the allotment for essential employees to have childcare assistance from the state, that the money has run out. So they're not going to be having childcare assistance when some families need this more now than they needed last month. So I was wondering if you had any plans of maybe trying to allocate more money to that fund to provide more childcare assistance for our essential workers.
I know from the standpoint of my office, we're looking at it now, but maybe Bill, you could, maybe General Hoyer could speak on this for a second. But with the federal dollars being cut out and everything, it's going to be problematic. But anyway, maybe General Hoyer or somebody else could speak on it.
Governor, we'll have to run that answer to ground and get it back to Taylor, and I'll work with Secretary Crouch to see if there's other assistance out there.
All right, thank you, Taylor. We have a new reporter with us today. This is Junate Dill with the Associated Press.
Hi there. Thanks for having us here. Janate Dill from AP. I'm wondering, with the CARES Act funds, how much the state has left in those funds, and if there are any plans for additional expenditures before the year ends. Thanks.
Okay, I don't have the number exactly, but I can tell you real close. We started with $1.2 billion. We have bucketed 278 on the to replenish our unemployment fund. We bucketed an additional $400 million, in order to assure us the protection against raising, taxes on our businesses from the standpoint of depleting unemployment dollars, and then we made an adjustment, from that. We took $50 million of the $400 million over and put it in a bucket for PPE in regard to, needs, from the standpoint of the schools for additional PPE and or testing if we needed that. I don't think we'll need it, but it's there as a security blanket in case we do need it. From the standpoint of our small businesses, we bucketed $150 million for our small businesses, and I think through today we've sent out like $14 million. So there's going to be additional dollars that are going to be there. And from the standpoint of our cities and our counties, we bucketed $200 million of the $1.25 billion, and I think we're at $104 million. It's gone out on that. We're pacing on that to where it looks like that $200 million may possibly be a little light, but we're going to come in real close on that $200 million. On the dollars that are the small business dollars that are sitting there in that bucket, we're going to probably end up with $100 or $125 million of additional dollars there that we don't have a home for right at this moment, which is great news and everything. From the standpoint of $50 million that was put into highways to be able to attend to roads, to be able to get people to medical facilities, we've used that. So the net of the whole thing, the way the whole thing would come down, I think there's some additional dollars that are still sitting in the unemployment fund, because we had 400 that were sitting there, and we really think we'll only have need for 250. So there's dollars that are sitting there, probably somewhere close to 100 million that is still sitting there that we have access to now, because of the 150 that was there, we put 50 over into the school PPE and testing. And the other place where there's dollars, there's excess dollars in the unemployment, 100 million, and there's probably excess dollars in the small business of 120. So all of it put together, there's probably an excess still of close to $200 million that we could, get out to whatever needs that we may have. And we've got 50 million that's still sitting there to be able to help us with broadband. We've got 50 million that's sitting there for the PPE and the testing of the schools. And we're in great shape as far as having to potentially raise taxes on our businesses. We will not have to do that. And so I think that pretty well wraps up the CARES money. And I didn't have any notes, but I think that's right. And in fact, I know it's right. I'm going to do it every day.
All right, thank you. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, West Virginia Public Broadcasting. My question is about this, similar to the one I asked earlier this week, this 5% daily positivity rate and the 7-day rolling average. My question is that determined by positive tests versus overall tests, or the rate the past 7 days? Because if you look at the past 7 days, we're at 5.23. If you take an average of all those positivity rates. And so my question is the move to keeping schools that are orange from coming back in part of that new policy, or is that a different, I guess, a different idea altogether.
Well, let me talk just a second, and I'm going to ask Dr. Amjad to get on here and talk with me about this. But first of all, we're not above 5% yet. The reason we're not is because the numbers you're looking at, I think, include congregate, numbers as one for one. And we don't look at those as one for one. If a nursing home has 15 cases, they go in as one. If they have 15 staff members, they go in as 15 because they go out in the community. That's where I don't think we're there yet, but we're trending close to there. And by trending close to there, I think it would be not necessarily frivolous, but I think it would be a mistake to allow us to go to school in Orange and potentially just compound this situation for our teachers, our service personnel, our kids. I mean, for crying out loud, we're close. We don't want to add more wood on the fire. We're close. And so that's from that standpoint. From the standpoint of the 5% level and everything, we're watching it. We're watching it very closely, but I think that the numbers are skewed from a congregate setting versus non. But anyway, Dr. Amjad, if you could jump in and add something if I left something out.
Sure. Dave, our percentages, when we look at them, I mean, we have the two numbers up there, and I mean, it's a 7-day rolling average. So a lot of people do ask about the 5% because we talk about that a lot. But our cumulative percentage on our dashboard right now is at 2.5, and that's the 7-day rolling average of all the numbers that we're looking at. And it went down, to 4.18, but it does look at all of the cases across. So that does include all of our cases that we look on a daily, but it's an average as well. But as you mentioned, it doesn't add up, but that's because of what the governor mentioned, that it doesn't include all the numbers that everyone gets to see on our dashboard. So that's why when people try to calculate it, it doesn't always add up. But that's also what Secretary Crouch refers to, that the lab numbers that come in aren't always on time, because even when we push the lab numbers online, there's a delay factor included in that. So that's also sometimes taken into account. But that's why the numbers sometimes seem off when people try to calculate them. Due to that delay in lab reporting and the delay in how we are putting it on there, because of the labs, of how they're giving them to us from the different lab sources and all the different departments across the state. But as far as the county level, we use that 5% as a gating strategy to enter of our goals of 5%, but then we have to go down to the county level when we're talking about the map and the orange and the red and all the colors that we refer to. But Dr. Marsh likes to talk about that a lot as a gating strategy of 5% being our goal. And we hear about that a lot, but it is a 7-day rolling average that we look at. But the numbers, that's why a lot of people don't get the calculation a lot, because of the different timing of the labs coming in, and it's difficult to get the exact numbers that we have up on our screen.
All right, thank you, Dave. Next, we'll go to David Beard with the Dominion Post.
Hi, I have a follow-up question, I guess, to Steve Adams on the athletics. It's a further clarification. A county that goes orange won't be busing in their kids that following week. But if the training is going to continue, will the counties be required to bus in the athletes, or will they just have to find their own rides? Thanks.
And David, we haven't discussed that with the county, but I'd say yes. Superintendent Birch will come out with that, but I absolutely think, from the standpoint of making sure that our athletes, don't lose conditioning, I think we should absolutely bus them in.
All right, thank you, Dave. Next, we'll go to the Charleston Gazette-Mail. I'm not sure whether it's Joe or Katie, but Gazette-Mail, if you're there, go ahead.
This is Joe Severino. Governor, I'd like the panel to weigh in on this. 10 counties are in the orange right now. Some are likely to stay there, and more may soon join them. If West Virginia's number one goal is to get our children in school and to keep them there safely, and we say we're going to lose a generation if we don't, why are there no consequences for adults when a county goes orange? The places where adults are spreading the virus are not being closed. Only schools are getting closed. So, when is the time to start holding adults accountable for putting counties into the orange? Thank you.
This is an easy one for me. I agree with you. I agree with you, and we're looking at that. Every single person on my team is looking at it, and we're looking at it across the board. It absolutely is a crying shame that we're having to have kids not be able to go to school, suffer through all the ramifications of a special needs kid or someone that needed counseling or someone that needed, just a friendly face to talk to, or the education, dilemma, that we run into there, or everything from economics to daycare to everything else. And then we have situations to where, like it or not like it, but adults can be doing better. And so we're looking at it, and I'm sure as time goes forward, we'll be making more and more recommendations. None of us want to take things away from us, whether it be, indoor dining or what, whether it be our bars or our hair salons or whatever, but for crying out loud, all of us are going to have to step up and do any and everything we can to shut this down. But I do not disagree with your question.
All right, thank you, Joe. Last question today goes to Sean Stinson with the Pendleton Times.
Yes, Governor, this question is for you. This is in regards to just clarifying that if a county goes orange only on the weekly, that is when the schools close. And also in regards to this panel that you're talking about that would look at doing tweaks, possibly to the orange, who is on that panel? And also, what tweaks are you looking to possibly do for the orange? Thank you.
Okay, I can answer the back end of the question. I did not get the front end. If you could ask me that one more time, the first part of the question.
Yes, Governor. I just wanted to confirm that when you're saying that the schools close when they turn orange, that you're referring to the weekly update, not the daily update.
That's correct. That part is exactly correct. It's a Saturday night update, for the following week. Now, in regard to the tweaks and the panel, Dr. Amjad, you're going to have to go through, or Bill, you're going to have to go through the people that are on the panel from the standpoint of the panel's responsibilities. Here's the bottom line, sir, and that is just this: is especially in our smaller counties that can be substantially influenced, from the standpoint of just a few cases, and how that reflects. I mean, we could very well have a county that went 7, 7, 8, 8, and then all of a sudden, boom, have some tests that come in, and they come in right on Thursday night, and when they're going to be evaluated, and that county jumps to 10.6. Well, if that be the case, what the panel does is the panel goes and looks at the 14-day rolling average and looks at the population of the county, and it tries to do any and everything we possibly can to assure that there's not a bias that has taken place and absolutely jump that county into the orange. And there could very well be a situation to where, take a county like Pocahontas County, the panel could look at that county, and over today and tomorrow and up until Saturday night when we're going to release, we said already we changed from 9 o'clock to 5 o'clock. We're going to release those color codes and everything at 5 o'clock. But the panel could very well look at Pocahontas County and say, wait a minute, the 14-day average or whatever it may be, or they're trending the right way and they're just barely in the orange, we're going to move Pocahontas County back to the yellow. But that's what the panel's there for. The panel's there to make sure that we just don't bias, especially a smaller county. But maybe Bill or Dr. Amjad, do you have anything to add to that?
Yes, Governor, and the governor is spot on with that. The makeup of the panel is Dr. Marsh, Dr. Amjad, Amy Atkins, who is our head of epidemiology for DHHR, for the Bureau of Public Health, myself, and Dr. Jeff Coben, who is Dean of the School of Public Health at WVU, giving us a different perspective, a public health perspective on this with this group. So that's the makeup of the panel. We tackle that now on Saturday, and the governor's right in the middle of all of that. So, thank you.
All right, thank you, Sean. Governor, that's all the questions we have today. I'll turn it back to you.
Okay. Again, I appreciate all the input. I appreciate all the prayers, all the concern. I want to say one thing that we, General Hoyer said it the very best, but we lost almost 3,000 people in 9/11, but we have lost thousands and thousands of more people. Through all of our efforts all across the globe to stop all the stuff, the attacks on America and everything, and we've been very successful. And we owe so much to these men and women that have defended our freedoms here. Sure, we've had things happen in America, but we surely haven't had another 9/11. And so for all those, just think of all those that gave the ultimate sacrifice for us. But not only that, think of the wounded that have come home with all the problems and all the difficulties they have. Think of all that has been given to us after 9/11. And so please keep all those people in your thoughts and prayers. And I would go back to just one thing, and that's just this. I made this note again. In regard to West Virginia, do you realize that no question about almost every state, especially every bordering state to us, they would give anything to have these numbers. And from that standpoint, you've done very well. But have you forgotten, West Virginia, the fact that we've said over and over, we're the oldest state. We're the sickest state. We're the state that's located within 600 miles of 2/3 of the population of this country. So what does that say? We are the #1 most vulnerable state in the country. Now, our numbers are trending the wrong way. And so we've got to take further action. If they continue, we will have to take even additional action. And that additional action will have to be starting to shut things down. It can't happen any other way. Our National Guard is telling us that we are not testing enough people. And we have got to start trending to where we're able and testing 7,000 or so West Virginians every day. We're not doing that. The more we test, the more we learn. Absolutely, we have got to be tested. Now, so I would urge all West Virginians to do one thing. Absolutely, God above is so in control, but He expects us to do our job. He expects us to do our job. I would ask you to pray. I would ask you to pray each and every day that we would all be able to do our job. And as we go forward, we'll get through this. But every day we don't want to continue to lose individuals that have been great West Virginians, and we do not want our kids to not be able to go to school, and we do not want our parents to not be able to go to work because they've got to stay home because they don't have the daycare. All of those things that I want so badly for us, going to school, going to work, absolutely not being sick. You know, we can achieve every bit of that if we'll just buckle up and buckle down. Please do that, West Virginia. I plead with you in every way. Wear your mask. Look out for yourself and look out for all your loved ones, and we'll get through this. Thanks so much.